So the question is there a market for this kind of dentistry? And there is absolutely no, even in today's economy, as goofed up as things are, it's been a roller coaster. There are patients who are investing huge sums of money in a lot of different things that aren't as important as teeth. Dog food they spend more money on every year than they do dental health. But with that, there is a market for this kind of dentistry. There's billions of dollars spent every year on cosmetic dentistry, and that's going to continue to grow. And the great thing about it is if you provide a quality experience for your patients, if the patient feels like you are a quality operator, quality practice, and you offer them some high quality opportunities, they will be willing to invest in it because it's what's right for them. There's nobody that wants a mediocre job. Nobody goes to the dentist and say, can you kind of do a halfway job so I can do it again in a couple of years? They're motivated to get it fixed right, and be done. Your job is to be a good enough dentist that you can provide that for them. Give them the opportunity to get it fixed right, and be done. Then you can maintain it after that. Give them that chance, and they're going to end up deciding to move forward. It's about doing wants for your patients. It's about doing the things, helping your patients to want the things that they may need. If you got a patient that's got severe decay, if you got a patient that's got migraine headaches and it's because of the bite, and it almost always is, it's about giving your patient an opportunity to want to fix that migraine and understand that you are one of the avenues that they should be pursuing in order to get that done. Patients don't buy anything from anyone because they need it, especially if it's a big ticket item. They want to get a new car, they want to have a nice home, they want to go on a trip, they want to get a big screen TV, they want to get a beautiful smile. Now, you want to give them some logical, functional reasons to support that. You want to help them to see why it makes more sense. But you have to understand that patients don't really need anything in dentistry. It's exceedingly rare that someone actually has a life-threatening change because of dental health. There was a young kid in Boston who a few years ago actually, from neglect, he needed to have an infection fixed and he didn't. It didn't get done, and he ended up with a brain abscess and he subsequently died. And as tragic as that is, because it's an absolutely horrible thing and I cannot imagine the pain that everybody involved in that felt, that's the last time that somebody needed to have something done in dentistry. Most of the time it's wants. You've got that patient that can eat a steak and eat corn on the cob without teeth at all. Teeth are a luxury item. They're an elective thing, and we want to help our patients to achieve the level of health that is right for them. What is it that they want? And that's what we're going to help them to do. So ask yourself, how many cases do you need to do a month to make a difference in your overall bottom line, in your practice? How many cases do you need to do a month in order to make dentistry more fun for you? How many times do you need to have a patient hug you and thank you through tears for changing their lives in order to make your day good? Well, one a day did it for me. One patient a day who thanks you like that, and you're doing things as a dentist that you never thought you would be able to do. That's the power of being comprehensive care physician of the head and neck. That's the power of being a high-quality comprehensive dentist. That's the power of comprehensive diagnosis and the power of neuromuscular occlusion. That's the power of what we teach in the Core 1 program here at LVI. It's an amazing start on a journey that's going to propel you through a career that should be absolutely life-changing, not just for the patients, but for you and your teams and your families, because you're doing things for your patients that are bigger than we ever thought. And there's enough work for every dentist out there to be way busier than they ever wanted, because the simple reality is most patients are stuck in a habitual occlusion approach, one tooth at a time, and it doesn't really fix things. And on top of that, most patients don't even have a regular dentist that they use like they should. So we've got plenty of dentistry to do, but we have to acquire the skills to be able to make the proper diagnosis, and we have to be able to acquire this, we have to be able to utilize those skills so that the patients can make the right decisions, what's right for them, and then get themselves into a mouth that really fits and works like they want it to. Every doctor needs to be the absolute best that they can be for their dentist. I think that is our moral obligation. It's a moral imperative. As a dentist, your job is to be the best dentist you can be. You want to be the best clinical dentist you can, and you want to continually get better. You want to be the best diagnostician you can, and you want to get continually better. You are in a profession that should be a lifelong journey of learning. Where are you going to get that education? What's the next step for you? I will tell you that the biggest advance that I made in my personal career was coming out to take my very first course at LVI. I had been through some phenomenal implant education. I had put in 400 or 500 fixtures as a young dentist, not many years out of school, doing 150 fixtures a year. I was on this path to just do implants and surgeries and loved it. But it took And one of the big cases that we did, 18 months to get to the point where we could start looking at restoring the patient. It took 23 months to get her from the very beginning when we were diagnosing and deciding to do calvarium grafts, ended up doing the 7-hour surgery in an OR, went through all of her healing, all of her rehab, finally got some bars in place, finally put some prosthetics in her mouth, and then 23 months later we were able to hear those tears of joy, and she discovered fajitas for the first time. Very, very cool thing to be a part of, and I absolutely cherished everything about what we did with and for her in that case. But 23 months is a long time to wait to be able to have a patient really understand the impact. You can do it with occlusion, you can do it with aesthetics in as little as a week. You get a patient out of pain, that patient's life has changed that day. That's cool. That's what dentistry should be about. And every doctor really deserves that. You went through and made the sacrifices to be a physician of the head and neck. That's what it takes. And so take that next step. Start your journey at the Core 1 program and discover for yourself how powerful this can be. All you have to do is ask the questions. The rest of it takes care of it all on its own. You get your team understanding what the questions are about. They ask the patients in your practice, and you'll find out that in your practice too, at least 1/5 of your patients are dealing with pain every day, or often enough that they know where they keep their medicine. They have Midol in their purse, they have ibuprofen in their glove compartment of their car, and they're on Fiorinol and Imitrex from their physician, and none of them are really doing the trick. You've got the keys to get them out of pain. We just don't know it because our profession's ignored it. Core 1 will give you the tools to help that patient that's in your practice right now who already trusts and respects you, help that patient to have a better quality of life. And then they start to tell the other patients. And I know that you, just like I did coming out of dental school, we were kind of warned against the TMD patients. They're crazies. You don't want to treat them. Don't get a practice full of the crazy patients. They're not crazy. They hurt. If you hurt every day and couldn't sleep at night, you'd go nuts too. That's what's happening. We hold the keys to get them out of pain. We hold the keys to get them better sleep. We hold the keys to make them better people. All you have to do is talk to them about it. So, you know that that's out there now. You're hearing stories about neuromuscular dentistry. If you haven't yet, you will soon, because there are more and more dentists that are using this in their practices. And there's so many dentists that have gone out and just spent their whole careers treating the way that they were always taught. And you learn centric relation, you practice habitual bite dentistry, and you never really do anything dramatic for your patients. As those dentists discover neuromuscular dentistry, nobody goes back and practices the way they used to. You can't put that back in the jar. Once you know what's going on with your patients, you can't help but see it. It's everywhere. So as you hear patients who are doing things a little bit differently than you, as you hear that their dentists are diagnosing things a little bit differently than you, take a look at what that is, because you're going to see neuromuscular dentists that are seeing things from a slightly different perspective. It's just a bit more involved. We started off 150 years ago making dentures fit better with bilateral balanced occlusion. It was all tooth-borne. Then the field of gnathology springs up in the 30s, and they're looking at things like making the bumps on the teeth right so that the patients will get along better. It made the dentures work better, but it was missing something. So they were looking at the bumps as being related to the way that the joint fits. And then they flipped it around and looked at the joints first. That's what centric relation's all about. Where do we get the joint in the right spot so that everything else works? It made the situation better because we were able to make a better diagnosis, but it didn't answer all of it. You can't put your patient in a centric relation-based bite in your denture and predictably be able to expect them to not have problems always. Next step in the evolution of occlusion is muscles. You get the supporting soft tissues, the muscles that hold the upper and lower jaws together. That's what neuromuscular dentistry was about, and it hit the scene in the 70s, and it has been developed since. And over the last 10, 12 years, it's made some dramatic changes so that it is much, much simpler, much easier, much more predictable, much more bulletproof. And once you see what this story is about, you can't help but not see it anymore. So you owe it to your patients, you owe it to yourself, you owe it to your profession to get out to Core 1 and just learn a little bit more about it. Then make your mind up for yourself. Does this make sense? Because I think you'll find that it does. That's why you want to become a mouth doctor. That's why you hear us preaching about not being a molar mechanic, but to become truly a mouth doctor. It's like the charge that you had in dental morphology in your freshman year. I could teach a monkey to fix teeth. You want to be a mouth doctor. This is how you do it. And so it's time to take that step. Problem is, as you do this, your best will keep changing. The best that you have to offer should be different in 2 years than it was 2 years ago. If it's not, You need to take a look at what your training's been, and you need to figure out why. Because we should continue to grow. Our field is growing so incredibly rapidly, there's always new advances to explore. There's new dentistry to learn, there's new ways to do things. This is one of the ones that will create the foundation for the rest of your success. Learn about neuromuscular dentistry and learn about the philosophy behind what we're teaching at LVI. And I think you'll find after that 3-day Core 1 program that it changes a life for you, for your team, for your patients. So it's a good thing to have the very best keep changing, and it's a good thing to explore new avenues in dentistry. It's a good thing to learn everything that you can learn about dentistry. And it'll be a good thing for you to come out and join us at Core 1. I look forward to seeing you there. Again, I'm Mark Duncan, Clinical Director here at LVI. Thank you for your time, and feel free to contact us if you need anything. My email address is mduncan@lviglobal.com. Thank you.